Thank you very much, Joanna, and we'll come back to you for some questions later on. I'm now going to hand straight over to Lesley Drake, who is going to talk specifically, I think, about schools as a platform for promoting health. So, Lesley, as soon as we have transitioned, you can take it away.
Yeah. Okay, so thanks Brad and Joanna for setting the scene. So I'm going to skip through some slides because you've already addressed some of the issues that I wanted to. So obviously we're on the same planet. I'm going to focus on school health and nutrition at scale. So let's stop talking about doing stuff. Let's do it. And so there's countries in sub-Saharan Africa that are actually investing their own monies in the value of school health and nutrition. And this is a slide that I see so many times in sub-Saharan Africa. It's a slide that we put together from PCD that shows where the school is. So the question from earlier today was, where is the school? And so the school is at the heart of everything. And so whether it's under a tree or 1,000-person urban setting, the school is there. And what we need to do is engage with the community, as Brad was saying. And so when we launched Fresh at the Dakar Education for All in 2000, we looked at the underlying pillars. We looked at policies, we looked at safe water and sanitation, we looked at services, and we looked at health education. But then you start to see how the school can actually be something that matters to communities. So you're looking at inclusivity. You know, we're not looking at hardware here, we're looking at software. How do we get the kids back into school that should be there? We're looking at basic interventions like getting glasses on school-age kids. We're looking at getting the parents that are the smallholder farmers, give us your food, we will pay you, we will forward contract you to actually provide the food to school feed your children. It's a win-win. You're looking at, well, if we can't do a simple health intervention, we'll refer you to the medical people. We will forward you the information back to the communities in terms of and one of the key things that's happened, it took 7 years for us to put this evidence to bed. And so the evidence for volume 8 of DCP3 is actually saying, and the global health economists are actually saying, that school health and nutrition really makes a difference. And here's the evidence, and here's the packages that Brad was talking about earlier. And this is what the framework can do to make sure that happens. The key message is it's not just about 1,000 days. So my message has always been, well, what happens at 1,001 days? You know, it's good, and we should not refute the fact that we need to invest in the first 1,000 days, but we need to move the child through the platforms. And the evidence is clear that we need 8,000 days. And that gets you to a kid that is 20, 21, whatever legal position it is in the country, to make that an adult. And we should not refute that. If you look at the evidence, and the school is where it should be. And so we have this evidence base that myself and Brad have been working on in terms of education, in terms of, well, what can schools do? So I'm of the opinion that let's stop talking about this stuff and let's get it done. And so what I want to focus my presentation on is what countries are actually doing, and how do we extrapolate that to other countries to make a move. I'm going to skip this slide because Brad actually talked to this, but you see that a key piece that's coming up is about adolescence. So you got the growth spurt in the early years, but you've also got this adolescence piece. And so we've been primarily focused on the primary education. We should be looking at the secondary education, sexual education, and pieces that the kids need to know you can see that, we all know that kids go crazy in their teens, and there's the evidence that shows that kids go crazy because of myelination. There are 2 essential packages, as Brad talked about. And then if you look at the median significant effect sizes on education outcomes, you can see that we all need to work together across health and education, and there are priority issues that we could work on together. We have a framework, we have the instruction, we know how to do this. And here's a classic example, and I can see it on the board outside, that just by deworming, it's a simple 1 pill per child per year, you're looking at IQ points, you're looking at the school-based interventions. So there is ways that we can do this together. Now, one of the things that I think is really important is looking at the cost-benefit ratios for the school-age essential package. Now, school feeding might look like it's really expensive, but when you actually add that to the school as a platform, you could put deworming on there, you could put health education on there, you could put vision screening on there, and the main message is about how the governments can provide school health. And then you put all of these other things on top, and the cost-benefit ratios go way up. And so here's an example in low-income countries that the food is the main cost driver. And if you put all of the other things together, for example, in Nigeria or Ghana or other countries, you're looking at something that really makes sense in terms of developing a package. So working across health and education, you're looking at well-designed health intervention in middle childhood and adolescence can leverage the current substantial investment in education and improve design of education programs. The synergy is there, and we're not making enough of it. And so the education is willing to put their money there. They want the health sector to guide them in terms of what they need to do. We know what needs to be done, and we know what interventions need to be done in terms of the different contexts. So whether you need deworming, whether you need feeding, whether you need health education, we have the plan. And what the problem is that we're not linking those we're not joining the dots in terms of making sure that health and education at the country level is making for plans that make sense. And so I want to just talk about 3 SHN success stories in terms of where we've made sense. And so homegrown school feeding, you look at this and you look at promoting agricultural development. These are the parents of the kids that we want back in school, whether they be boys or girls. We want them back in school. The parents are forward contracted by the government to actually provide the food in a nutritionally balanced way. So it's not just it's a win-win, not just for the children and the communities, but improving their education, health, and nutrition. The smallholders, we've got evidence from Ghana that shows that we've significantly improved the smallholder farmer livelihoods of smallholder farmers in Ghana just by this stable market. They send their kids back to school, we pay them to provide the food, and everyone's a winner. And so one of the arguments that we've had is looking at school feeding in terms of, it's not just about nutrition. There's the nutrition argument is out there, but it's about social protection. So when the World Bank put $1.2 billion into a social protection fund for countries to access, they didn't see that they would use that for school feeding, but they did. And every single country that had access to that fund used it for school feeding in some form or other. And it's not just about the health and nutrition, it's not about education, it's about social protection, it's getting the kids back into school. So if that's what works, then let's do it. And so I just wanted to draw your attention to something that's happening in Nigeria. So in Nigeria, the president, I work directly for the president of Nigeria, and he's put all of his money into his social investment program, and one of 5 programs is school feeding. And he's saying, let's feed the kids. And so when we look at the analyses, we're looking at 75 metric tons of fish, 4 million eggs, 33,000 birds, and 355 of cattle a week in Nigeria. And then you look at some of the states are now the primary investors of Kentucky Fried Chicken in Nigeria. They are providing the chicken for. So it's not just about the local demand for school feeding, it's about investment in rural economies. So this makes sense. This is a weekly economy. And I'm seeing the same thing in Ethiopia, I'm seeing the same thing in Ghana, I'm seeing the same thing in Madagascar. And so this is a momentum that we need to get behind to actually say school feeding is a stable market. We can provide the food in a nutritious way to the kids, but it's also an investment in rural economies. So it goes across the sectors. And this is where I think we could, as a group, have a look at how do we support that? How do we look at this multi-sectorally? How do we look at, governments moving forward in terms of multi-sectoral? I threw this slide in. Bill Gates is interested. He gave me $21 million to actually look at homegrown school feeding. The second picture is me with the president of Ghana, and then also the minister in Nigeria. So these high level people are interested in school feeding and school health and nutrition, and what they're asking from the international community is for support in terms of how to do this. One of the ways that we're doing this is by homegrown school feeding in the menu, and trying to look at local produce and seeing how we can do this. But the one key thing that's happening is that the kids are actually taking this home. And so the kids are actually seeing that they've got 57% of vitamin A. Mum, I need more cassava leaves. It used to be a poor man's food. It's no longer a poor man's food. And so you get 12% energy, 19% of protein. You can see if you add pigeon peas into that, you get more protein. You can see supplementally, if you add the WFP sprinkles onto that, you're actually getting a really good qualitative menu for the kids. But that's feeding. But let's look at refractive error. And so the Lancet has actually embraced what we've been doing for the last 7 years in terms of putting kids do no harm. And so can we use the teachers to prescribe the glasses that the kids need? And the answer is yes. And what happened was that we found that the 20% of the teachers also needed the glasses. So the kids could not see the teacher could not see them. And now, as opposed to just giving a prescription note, go to the capital to see your ophthalmologist, your optician, for glasses that you cannot afford, what we're saying is we've found ways that we can, and literally, it's plastic bags worth of prescription glasses. So when the kids get prescribed by the teacher, you have a plus 0.25. Here's your glasses. And so the glasses get onto the kid's face immediately. And so it's something that's revolutionizing school health in sub-Saharan Africa, worm infection. Now, I worked on a program in India where we now have 17 million kids in Bihar being dewormed every year. It's been going on for 3-4 years, and now it's up to 240 million kids in India. And basically, it's a pill once a year, and the teachers are delivering this. And the Ministry of Education and the Ministry of Health are working together to make sure that this happens. And so when you talk about scaling up, this is action. And so 240 million kids a year are being dewormed. 300 million are being glasses put on their faces. 300 million kids are being fed. And so I think that what we need to do is move from this procrastination about policy and actually look at what countries can actually do, and the countries are actually doing it. And so we should learn from the scale up, and we should maybe push that out as a group in terms of, well, we've got free drugs for deworming, we can do this. And my position is that, here are countries, big, Ethiopia, Nigeria, we've got India, we've got all of these countries that are doing stuff, and we need to be backing them in terms of not procrastination about policy. We need to be supporting them in their action interventions. And so last slide is, have a look, see what you think, and let's get behind these countries.
So I have 2 questions for you. Firstly, who is we? And secondly, what do you think are the main challenges, but also the main pathways to scaling up, and if you at a cost-effective level? And I apologise for asking you such a big question, but you know what I'm going to ask is, could you be as concise as possible so that we can get more questions in? Thank you.
Okay, so thank you for that. I think that we have enough evidence. We have tools, we have frameworks, we have systems that can be in place. And what we're not doing is moving forward to support countries in moving forward with what works in a contextual way. And so you look at Nigeria, they're feeding 7 million kids every day a hot meal. We've got the same thing happening in Ethiopia. We've got the same thing happening in Ghana. What is missing is the policy piece. So what we need to do as a group is to actually work with education and health to make sure that we have a school health and nutrition policy that makes sense. And where does that money come from? And so in Nigeria, it comes from the presidential purse. It comes from the presidential purse in Ghana. You know, we as technicians can help in terms of putting that framework together and helping put a program together, but the money needs to come from the countries. So what are we doing to support the countries in terms of what they need to do to put that money together?
Thank you. Lesley, I know you wanted to come in.
Yeah, I think we're at a real point where we can really make an influence on policy in low and middle income countries, and they want to know what to do, and so we can provide that information, but for primary and secondary education, that there are different packages, and we need to be working with the countries to push this forward. And so my main point is always about no one size fits all. Here's a framework. Here's the policy that you have in your country. What do you want to do? How can we help? And how do we influence the policy and implementation in terms of making this work? In terms of, for example, school feeding, you have investments from multiple sectors, and we're not looking at those sectors in a conjoined way. What we need to do is look at the context of each country to say, well, who are you talking to? How do we make this move forward? You know, in Senegal, who is working in agriculture, education and health? Can we put a technical committee together to actually look at how we can use the school as a platform for not just school feeding, but school health and nutrition, but also how do we move forward together as a multi-sectoral piece? This is complicated, and we need those guys around the same table to be able to see what happens in Senegal, what happens in Nigeria. You know, the president of Nigeria has just put his whole money on social investment on school feeding, and he's put multi-billions of dollars behind it. So why aren't we, as the technical guys, helping him to provide that evidence task to work towards how does that work in the different states? Every state is different in Nigeria. Every state region in Senegal is different. But how do we put that in a policy network that the technical people like we are help the governments move it forward in terms of their policy directive?
Yeah, I'm Emmanuel, a KU student too. Yeah, you made mention of Nigeria, the president, investing money for feeding of children. So I want to really be sure, which president are you talking about? Is it the current president or the previous one? Because actually, if he really doing that, I think it's not in the whole Nigeria as a country, maybe in the rural area, in the northern part where he's from. Because where I'm from, nothing of such I've heard of. So I just want to be, if I'm wrong, you're right. Is he using his own personal money or the government money? So that's what I want to be sure about. Thank you.
Okay, thank you. And Lesley, so you can take the specific question, and then also if you want to talk about monitoring as well briefly, you're very welcome to. Thank you.
So 2 questions. First of all, about monitoring evaluation. As a scientist, I'm at grips with Imperial College because I refuse. I don't see the value of randomized control trials anymore in terms of school health and nutrition. What you need is proper monitoring and evaluation in terms of process. So how many kids get the interventions that we need? And so what we're trying to do with the SABER piece is actually put together a framework where the education sector looks at the health interventions and actually reports back. And so we don't need hardcore scientific RCTs anymore. What we need is inculcation of school health and nutrition into education sector implementation. And that is happening in many countries in sub-Saharan Africa. So I don't see the quality of the investment of RCTs anymore in that. This should just be part of the practice. Health matters. Children learn better when they're healthier. And we just need to put those indicators together. And each country is looking at those policy indicators to be just part and parcel of what they do. Now, so my personal opinion is that we should just have those monitoring evaluation pieces of school health and nutrition within education sector policies. As Brad was talking earlier, this needs to be part of education sector plans moving forward. We need to cost them, and we need to monitor and evaluate. We don't need RCTs. The second question about Nigeria is that this is part of the social investment program of Buhari. And so he has 5 investment programs within his social investment program. One of that is school feeding. It's the money from the government that is funding this. I provide technical assistance to him that is provided by different funders. And so what he's looking at, he's now currently in 17 states. He's driving me crazy, by the way, because he wants to be in 27 states by the end of the year. And I'm saying you can't do that without a framework, and you need to look at the contextual situation in each state. And so I can provide you with the information of the 17 states he's in, but it is government money. And it's government money that is funding the smallholder farmers to forward contract to the school feed-in market. And that is what he is providing.
Okay.
And he's also providing money to the education sector in terms of health education, nutrition education. He's also providing money to the health guys in terms of you need to work with education to make sure the messages are right. And so it's health, education and agriculture working under the purse of the president. And in my opinion, that is what works, because if you put school health and nutrition under education, you've got a series of problems. If you put it under health, you have a series of problems. If you have high-level presidential overview, you put the money within the Ministry of Finance, then you define the roles of Ministry of Education, you define the roles of Ministry of Health, you define the roles of agriculture, and they have their own purview. They then have to be responsive to the Ministry of Finance for the money for them to do their job. And that is why I think that Nigeria is really taking the global lead in terms of this cross-sectoral piece, not just health and education, but agriculture as well. and investments in rural economy, but you need that high level person to say, this is how it is. You tell me what you need to do, health. You need to tell me what you need to do, education, agriculture. You put your bill in and you report to finance. And for once, Nigeria is actually ahead of the game.
Thank you. Lesley, before I could take the questions from the audience, I wanted to bring you in on the sustainability point as well, because the issue of school feeding and nutrition in school, it's not a developing world issue on its own. I mean, you and I are both from the UK. There was Jamie Oliver's campaign, but also actually one of the things that the financial crisis really exposed is that a lot of children from more disadvantaged households were not getting meals at school, and that actually what you're seeing that's filling the gap, forget food banks for a moment, is corporates, so Quaker giving oats or whatever. So there's a sustainability problem even in relatively affluent countries, isn't there?
So I think there's two pieces here, and myself and Brad have been talking about the high income country pockets of poverty. And there are kids in the UK, there are kids in the US that are going hungry, and it's not to do with the fact that the families don't have the money. They really don't have it, and so the kids are going to school unfunded. We had to, in the UK, open the schools in the summer to actually feed the children in Scotland. And so that's a high income poverty issue that I think is being neglected and we should touch. The key thing about low and middle income countries is, I think that the key to this is investing school health and nutrition into education sector plans. And what is missing there? So GPE has stepped up to the mark, and maybe Brad, you want to talk to this, but school health and nutrition now can be part of an education sector plan. What's missing is the costings, and this is where TA comes in and technical assistance comes in, because if they don't, we want to feed our children, it is different from we want to feed our children and it comes to this amount. And so at the minute, the education sector plans for low and middle income countries look at and identify school health and nutrition as a good thing, but they're not costing it. So we need to get people in there to actually cost it. And then they can put it into their education sector plans, and GPE and their donors will fund it. But at the present, it's all a bit fluffy.
Yes, thank you very much, Jean-Jacques Scholl from ID International. My main question goes to Mrs. Drake. I fully agree, and I signed that nutrition is the most important thing, but I'm a little bit surprised that one still would be looking at buying food. I mean, I thought we had moved away from giving a fish rather than learning how to fish. And I wanted to know whether she has been working on building school gardens that can produce that food. Thank you.
Yeah, it's a really good question, and thank you for that, because what we're trying to do is we don't want potatoes from Idaho anymore. We don't want development. Where we want aid is, for example, in northeast Nigeria, where you have a crisis. But where you have development, you can work with the agricultural sector, health sector, education sector to put together a policy that contracts the agricultural sector to provide X kilos of maize, X kilos of fish. I showed you the presentation in the presentation this morning, about 75 million tons of fish a week. 4 million eggs. These come from Nigeria. They're not from anywhere else. And so, how do we support the local communities to provide for this market? And we do that by providing them with a stable demand. The stable demand is 1-800 days of school and one hot meal a day. And we can provide that locally. So we don't need the Americans, we don't need the UK, we don't need anyone other than the countries themselves to provide the ingredients for a good, nutritious meal. And that's what's happening. And we're reaching...
But you have Bill Gates, so it's coming from abroad still.
Sorry?
I was asking for school gardens, for the schools and the kids to learn how to produce that food.
All right. So with school gardens, I have a particular point there. The school gardens are great, and school gardens actually are nutrition education. You can provide little bits of herbs and whatever to complement the school meals. It shouldn't be that the kids are actually working in the gardens in detriment to their schooling. And so they have now an allocation, and I'll give you Ghana and Nigeria as examples of where they have lessons on the school gardens to actually understand what the nutrition means and what the school garden can produce. It's not about them working in school gardens. We need them in the classrooms, not in the gardens.